You got a haircut.
Got a hair.
Actually, he just washed them in the shower. Okay. Now today, what's the date today? March 12th. Good morning. This is Tuesday, March 12th, 2024. The Insurance Committee of the Tennessee House of Representatives is now in session. Madam Clerk, please take the roll.
Representatives Sapicki, Davis, Freeman, Helton Haynes, Hemmer, Hicks of Hawkins, Hill, Johnson of Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin of Carroll, Chairman Kumar.
Here.
Mr. Chairman, you have a quorum.
Thank you. Members, do we have any personal orders? Seeing none, we have a short but important calendar. Our first bill is House Bill 2940 by Chairman Hicks. I have a motion and a second. Mr. Chairman, you're recognized.
Thank you, Mr. Chairman. Thank you, committee. This bill was brought to me by the Tennessee Disability Coalition. This bill establishes a program by which a qualified individual with a disability can pay a premium to access Medicaid long-term supports and services. Current TennCare policy strictly limits eligibility for Medicaid long-term supports and services. These strict income and asset limits severely diminish the types of work a person with a disability can aspire to and how much they could choose to work. Long-term supports and services are absolutely necessary for many Tennesseans with disabilities. Tennesseans with disabilities are presently with an impossible choice: limit one's career and ambitions, impoverish oneself, and place undue strain on a family in order to be eligible for Medicaid, or go without vital care, supports, and services. 46 other states have a program such as this that allows their residents with disabilities to go to work, sustain their families, and live their lives without having to worry about losing access to necessary care. This bill is an important priority for the disability community and opens up a brand new horizon for Tennesseans with disabilities to go to work, sustain their families, and live their lives. With that, Mr. Chairman, I think we have Jeff Strand and Robbie here to testify to the committee, if that be your will.
Thank you, Mr. Chairman. Members, we do have testimony. So without objection, we'll go out to session and recognize Mr. Barberi.
Thank you, committee, and thank you, Chairman. It's a pleasure to be here today. Before going right into my testimony, I wanted to take a moment and briefly share a little bit of my background. I've lived in Tennessee. Oh,
Kindly state your
I'm so
name
sorry.
for the record.
My name is Robert Barbieri.
Please go ahead.
Thank you. So I've lived in Tennessee for the last 15 years. I attended Vanderbilt University, played football for them, met my wife in college, and I've been living in Nashville, working in finance for the last 12 years. 2 years ago, on a typical night, I was driving to dinner. Nobody else was in the car. My car flipped off the road, hit a telephone pole, and left me paralyzed from the shoulders down. Was in and out of hospitals for a few months and came back to Tennessee and faced the dark reality of living with a high spinal cord injury in Tennessee. I initially my wife and my parents were doing the bulk of my caregiving and taking care of me, but quickly I learned that that was not sustainable. I was confronted with the reality that people like me will pay upwards of $80,000 a year in caregiving expenses just to maintain a decent quality of life. Unfortunately, private payers do not cover that. So I found myself in a position where I was sacrificing everything just to remain Medicaid eligible. This the so when I came back here, initially I wanted to get a job because I thought, well, if I could pay for my own care, if I could supplement the caregiving, then I would be okay. But I soon learned that if I earn more than $19,000 in change a year or have more than $2,000 in assets to my name, then I'd be unable to retain Medicaid coverage, which is so vital to my well-being. So I find myself in a position, and I want to work. I consider myself employable. I have 2 degrees from Vanderbilt, and I want to contribute to society and pay taxes. But I find myself having to choose between employment and marriage and Medicaid. One of the reasons that I got a divorce was for Medicaid eligibility, and the reason that I'm withholding employment right now is for the same reason. So I I find myself in a catch-22. I want to be able to earn money, pay taxes, and save for my future. But me and a lot of other people with disabilities, I see them around the community, and they're getting divorced, they're not working, and they're remaining at home. Working in addition to paying taxes is great for my mental health. It there's so many other benefits, and I think in Tennessee we need policies that improve the employment rate for people with disabilities, not limit it. So that's I think that's it. Yeah, really happy to be here, and thank you for hearing my testimony.
Thank you, Mr. Barbieri. As I said before, you are a brave American. We admire your academic accomplishments as well as the way you have handled great diversity. God bless you, sir. Members, do we have any questions for Mr. Barbieri? Representative Johnson, you recognize.
I just want to say thank you because I talked to a lot of constituents in my district in the same situation. I want to work. I want to do these things, but it will put at risk my Medicaid. And that seems so counterproductive to what we need to be doing. And the abilities that you have and that so many other have, you should be able to use those to your full potential. And that this is keeping you from doing that is horrible. Is this bill going to completely remedy that, or?
Yeah. So if this bill is passed, it would drastically improve the quality of my life. I would be able to be employed, and I would be able to pay 5% of my earnings as a premium to earn Medicaid services. And if you look at the wage gap and the marriage gap between able-bodied people and people with disabilities, it is far wider than I think it should be. So this would help me and thousands of others, be able to pay taxes, save for our future, and contribute to society. So
Thank you. I also know a couple in my district who divorced for this very reason as well. So thank you.
thank you.
Thank you, Representative Johnson. Any other questions? Chairman Sparks, you're recognized.
Thank you, Chairman. Thank you for your testimony. What's your degree in? You may have mentioned it.
I have a bachelor's in economics and a master's in finance.
Are you working now part-time?
No, I don't. I can't. It's want to apply, but I feel like I owe it to my family. That's like leaving 80 to 100K on the table. Otherwise, I'd have to go to a nursing home. So
Yes, sir.
I can't work right now. Yeah,
Yes, sir. I appreciate your testimony. Thank you. Thanks for coming up here.
thanks.
Seeing no other questions, we will go back into session. Chairman Hicks, you're recognized. Members, do we have any questions?
Thank you, Mr. Chairman. I just want to give you a few numbers here. Tennessee ranks 42nd in the U.S. for disability employment rate. Tennessee ranks 38th in the U.S. for disability earnings. Tennessee has the 13th highest disability poverty rate in the U.S. That's some pretty stout numbers. And, you know, I think as we're able to come down here or whenever we go home and we're able to do a hard day's work, sometimes, you know, we take that for granted. And just imagine what that would be like if you got in a predicament to where you couldn't go do that. I've always been a person that believes that hard work builds character and dignity. And I do believe it's a necessity. I very much do believe that. So thank you, Mr. Chairman.
Thank you, Mr. Chairman. No, it's, you bring a problem to us that is certainly thought-provoking. And I think a lot more can be done. And I'm sure you're thinking along those lines too. Any other questions, members? Seeing none, we are voting on House Bill 2940. All those in favor, please say aye. Opposed? The bill goes on to Finance, Ways and Means.
Thank you, Mr.
Thank you.
Chairman. Thank you, committee.
Item 2 on our agenda is House Bill 2051 by Leader Gant. Leader Gant, we have a motion and a second. You're recognized on House Bill 2051.
Thank you, Chairman and Committee. And what this bill does is it requires TennCare to reimburse air-based ambulance services that provide a covered service to a TennCare recipient at the rate not less than 67.5% of the federal Medicare program's allowable charge for participating providers.
Thank you. Members, do we have any questions? Just curiosity, what rate are they paying at now?
I knew you were going to ask that, and I do not know what the current rate is. I can get that to you.
I assume 67% is better.
Yes.
Okay. Chairman Johnson of Knox.
Thank you, Mr. Chair. Also curiosity, I know how much an ambulance ride costs. Do you know about the average cost of these flights? Because I'm unaware, thank goodness. Nobody close to me has had to do that. So.
Yeah, I think on average, they start at 50,000, and they exceed that even higher, I believe. So, but yeah, I can get you the exact cost as we go forward. So.
Thank you. We have a motion for question. We are voting on House Bill 2051. All those in favor, please say aye. Opposed? The bill goes on to Finance, Ways and Means. Thank you, sir.
Thank you, Chairman and Committee.
Thank you, committee. This brings us to item number 3, House Bill 2903. Got a motion and a second. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. House Bill 2903 is the Pain Relief Act. Members, we are all aware of the opioid epidemic and subsequently our efforts to decrease the use of opioids as well as to decrease the use of opioid prescriptions. In most ways, we have done well. The prescriptions written are down, but opioid use is still a problem. This bill asks the Department of TennCare in establishing their establishing and maintaining their preferred drug list, the division shall ensure that a non-opioid drug, if equivalent to the opioid, is available and will be made equally available to obtain. It does not prohibit an opioid medication from being preferred over the other opioid medications, but a known opioid alternative, if available, should be given equal consideration. And the physicians prescribing it or the hospitals using that will be reimbursed at their present rate. And thank you. I'll be happy to answer any questions.
Thank you, Chairman. I understand you have filed amendment for this bill as well.
Yes, we have two amendments. First one is 15009.
Motion second. All in favor, say aye. Motion carries.
And Mr. Chairman, the next one is 015364.
Motion second. All in favor, say aye. Motion carries. Chairman, you're recognized on the amendment.
Thank you. What I described was basically the amended bill. And I
Thank you, Chairman. Members, do we have any questions on the amendment? Not seeing any further. We'll vote on amendment. Well, we've already done that part. Voting on the bill. Any questions on the bill? Not seeing any. All in favor of House Bill 2903, signify by saying aye. All opposed? The ayes have it. House Bill 2903 goes on the calendar and rules.
thank you, Mr. Chairman. Members, is there any other business before the committee? Otherwise, we stand adjourned.